So this whole idea came to me that we need to democratize this whole referral process. We give patients a chance to look at information and just make wise choices before you have the surgery. This makes a ton of sense.
If there's a surgeon that consistently is performing at a subpar rate, should they even, continue in the practice, and how do people protect against that?
Are you sick and tired of the high costs and inefficiency plaguing our U.S. healthcare system? Do you feel like you're navigating a maze when dealing with insurance companies, only to end up paying a fortune for basic medical services? Then this Broken Healthcare podcast is for you. So get ready to take control of your healthcare. Here's your host, Ray Kober.
Ladies and gentlemen, welcome to another episode of Broken Healthcare. I have with us today Dr. Sanjay Prasad. I needs no introduction in our circles, but his history and what he's done within the industry as both a medical professional and now as a business leader is quite interesting. He's on to something with SurgicQuality. That's the name of one of his endeavors, one of his businesses. So we'd like to talk to him a little bit about that. But without further ado, Dr. Prasad, welcome to the big show. Thank you for joining us.
Oh, thank you so much. I'm really honored to be here.
Pleasure. I'd like to go back to the beginning because we've met and spoken at a conference, and it was a good conversation. And then in doing a little research, what I find fascinating is your journey really kind of started at the beginning, ground floor, if you will. Your parents emigrated here from New Delhi, India, back in 1962, if I'm not mistaken, and you were a 1-year-old at the time. I just gave away your age for anyone that can math. Sorry about that. Threw you right under the bus to get things going. But so I'm guessing they came over on like Carnival Cruise or Royal Caribbean. It was a luxurious vacation across the sea because, of course, they came from an abundance of wealth and prosperity and just decided to take a trip and settled here in the U.S. Do I have that right?
Well, kind of, sort of. What I will tell you, and this is all relayed obviously from my mom, who's still alive, and she told me this about a year ago. The reasons why we came to this country and how we ended up here were such in sync with what I'm all about. It was just astonishing to find. You talk about fate, but this is reality. It's amazing. So our parents came here to this country, and my dad had multiple choices to work in different Indian embassies around the world. He could have gone to the UK, but he decided to go to the US because we had my sister who had a condition that needed some attention, and we just couldn't find the right surgeon in India to get this procedure done. So Dad said, well, hey, we're going to go to America and find the right surgeon. And lo and behold, 1 month journey, through the Suez Canal, through this small little tugboat ship kind of thing, from what's been described to me. My mom's a vegetarian. Everybody's eating fish and, fresh fish, etc. And, nausea, vomiting, you name it.
Oh, gosh.
Waters.
So it wasn't Royal Caribbean.
No, it was.
It wasn't Pacific Princess.
No, it was pretty amazing. And they stopped in Yemen, I think, and they went through the Suez Canal. They were supposed to go to Barcelona. They went on to Gibraltar and ended up in New York City. So
wow,
it was quite a journey. And my sister got some surgery and she's fine now. But it was just so what a beautiful story.
You were a good student. You excelled. You, I believe, graduated from the University of Maryland with an undergrad degree in biochemistry, if I'm not mistaken. And then you went on to medical school from there. What was the moment where you said to yourself as a young person, I want to be a medical doctor? Or did mom and dad just say, you're going to be a medical doctor?
Yeah, I mean, in a lot of Indian households, that's true. But in my case, my dad really wanted me to be an engineer. And,
Ah,
as teenagers will do, they'll rebel, right, against whatever their parents want to do. So,
sure.
and my dad
That's
always said,
not much of a wait. That's not much for rebelling. If you
well, it really
if you
was.
decided to join a punk rock band, that would be
Well,
rebelling.
you have to remember it's a different climate than the kids have it today. But it was kind of unheard of to have an Indian kid get accepted to med school at that
Mm.
time. And and the track is such that you major in biochemistry, you apply for med school. Gosh, if you don't get in, you end up in a lab somewhere for a couple of years. You reapply. It's a vicious cycle, and a lot of kids know that. I mean, my interest in medicine started really in seventh grade when I had an ear infection. I went to go see my local ENT doctor. Did a procedure, drained the fluid out of my ear, and all of a sudden I could hear again. It was just enlightening. A lot of
Huh.
respect that the physician had, a lot of authority, and just such knowledge, and it was just such a role model for me. And I told myself that's what I want to do. I want to do ENT, and that was in seventh grade. So I just pursued it and persevered.
You know what strikes me about that? You had a great experience in a physician's office, and he treated you with care and respect, and you looked at him with kind of a little bit of awe and admiration. Amazing what this guy just I could hear again.
Yeah,
That's pretty cool, right? And I'm not in pain. I'm sure there was some pain involved. It could have been different. You could have been in an environment where the physician was rushed, maybe barking orders at his associates, whoever is assisting him at the time. It could have been a quite a different experience. And I often wonder, sometimes it's just a little thing that sets your trajectory in life on a different path. And in this case, you had a wonderful experience, and who knows? I mean, he may have played a big role in your decision to go down this path.
yeah, and I was very interested in microsurgery. I just got interested in, the microscope had just essentially come out in the 1970s, and it was starting to be used for surgery, and the whole thing about microsurgery and drills and also some intricate anatomy. So, the ear, the temporal bone, if you know much about it, the facial nerve, the inner ear, the temporal lobe, the cerebellum. They're all in close proximity. You get conditions that affect all those structures. So it was just fascinating, absolutely fascinating.
Yeah, and so I would imagine you've seen your share of tonsils in your day.
Yeah, and I certainly don't. That's not what I was specialized to do because I did ENT. I boarded in that, and after that, I kind of took a bend toward neurosurgery. So my specialty is really neurotology, which is a combination of, or a juxtaposition, really, if you will, of neurosurgery and ENT, where in a combined case, for example, we work on tumors that start in the brain and affect the temporal bone in the ear, and also tumors that affect from the temporal bone and then affect the brain in the opposite way. So very
Mm.
exciting stuff. It was a whole birth of cranial-based, skull-based surgery. I was so fortunate to have trained at the University of Pittsburgh at the Center for Cranial-Based Surgery in 1990 to 92, and trained with the world's leaders at that time. So I was just so fortunate, so lucky.
Yeah, and so how big a deal is that? You mentioned that, and I believe there was a fellowship involved, and you did several fellowships. How much weight does that hold when you get to train with the best of the best? The people that are revered amongst your peers. Is it really I don't quite have the analogy, but is it similar to being the apprentice of a Michelangelo? A true master, or does it not really matter?
No, I think it does matter. It sets the foundation, and like in any discipline, right? You have the basic foundation, then you have to build upon it. And I think people and patients and surgeons, young surgeons, have to remember that those are just the foundations, and there's a never-ending learning that occurs even beyond your training. So you may have a great foundation, but it's up to you to build the walls and to get that roof up, right? So, and that happens over years of practicing, learning, reading, taking lots of courses, and really keeping up with your specialty to be the best, absolute best physician that you possibly can be, because everyone should strive for that. That's in medicine.
Yeah, and so what really would you say, was it a desire to help others, to be a healer? What really was the impetus for you to say, other than, of course, what you shared with us already? Why did you want to become a surgeon? What was behind that?
Well, it's so satisfying, Ray. I mean, I don't know how to explain it to you, but well, maybe I can try to articulate this. If when you're removing a tumor, for example, from the facial nerve, and you're peeling that tumor off of the nerve, and the nerve monitor is very quiet, you get the entire tumor out. You see the patient after the surgery. The facial nerve is completely normal. The MRI shows the tumor's gone. There is no feeling that's more exhilarating than that. Absolutely none.
Wow.
Where you can take somebody who had a certain condition and improve their quality of life. That's what it's all about.
I can't even imagine. That's got to be extremely gratifying. And I would imagine that a lot could go wrong with a surgery like that. You mentioned seeing the patient afterwards, and I would imagine that there are only some things that you can assess after the fact, right? After the patient kind of comes to and is back with you, and there are probably signs that you're looking for to show you, hey, we're in the clear here. Job well done. Pat yourself on the shoulder twice. Our team did it right.
Yeah, I mean, obviously post-operative exams. There's, radiographic studies, CAT scans, MRI scans, and the bottom line is, you know, did we improve the quality of life of the patient? And that's, sometimes I think we in medicine lose track of that. We see a condition, we want to treat it, we have a hammer, everything looks like a nail, but are we doing the right thing for the patient in terms of quality of life? Because if you're doing surgery on a patient, you really should be improving that QOL quotient, if you will. And if you're not, you have to rethink, what you're doing. Does that make sense to you?
Yeah, you lost me at the quotient example. Say that again. What
Oh, the
what was
quality of
that?
life. So this is quality of life
Quality of life.
scoring. So they call it quality scoring. But I think you get the idea that if you're not making the patient, um, not improving their quality of life through surgery, then I think you have to question whether you should be doing it to begin with.
Yeah, no, and I think that's a great segue for SurgicQuality and the impetus behind SurgicQuality. If you could share with our audience a little bit about how you came up with the idea. What was the epiphany? What made you say, hey, there's nothing like this out there. We need to do this. And, where'd it come from?
Well, patients do, and we all know the standard and the current referral system that we have. You see your primary care physician, you get sent to a specialist really on the basis of habit, and not necessarily that, on cost, and not necessarily based on quality or outcomes. And that's where the problem begins, because the patient's told something from one surgeon, they develop a relationship, a rapport, that really kind of prevents them from getting other opinions, and really thinking for themselves. And that's really the crux of the problem, because, I tell you, this whole idea of where we started, how I started, came from a dinner I was having with a number of my colleagues in the same specialty. And we were talking about a certain type of surgery, stapedectomy, and we were just talking about how we do it, how each one does it individually. And we all thought, we had the best outcomes, right? But
Well,
nobody had.
for those of us who aren't surgeons, stapedectomy is what exactly?
Well, stapedectomy is an operation. It's done through the microscope. It's a very delicate operation to remove a tiny bone in the middle ear against the inner ear. Sometimes it gets frozen in a condition called otosclerosis. Patients develop hearing loss. And it's very delicate. It's probably the most delicate surgery that there is in our field, and it's done successfully 95% of the time. The hearing comes completely back to the point where patients wake up in the
Wow.
recovery room and they can hear again. So it's really quite miraculous. And what I was struck by is that all the surgeons thought that they had the best outcomes, but we had no objective data to show how one surgeon was doing compared to another with different techniques, right? And so this whole idea came to me that we need to democratize this whole referral process. In other words, what I'm trying to say is when a patient has a condition, we need to be able to get multiple opinions from different surgeons and really look objectively at their outcomes data, and that outcomes scoring, outcomes data needs to come back to the patient so they can make some they can make well informed choices. Does that make sense to you?
100%. I think the question on the tip of everyone's tongue would be, how do you do it?
Yeah, and so we thought about this a lot. I mean, we thought about self-reported, but it's just self-reported is not really. It's subjective. It's not comparable. It's very hard to compare. But we thought about really using AI, and AI came in recently, but we thought about looking at the surgeon's individual electronic medical records and looking at their procedures that they did last year, their surgical case records, and actually analyzing them. When we were originally going to do this through natural language processing, NLP techniques, and look for success and complication measures against an array of all the procedures they did last year and the previous year. Does that make sense to you?
It does. It does. So essentially, you are leveling the playing field, and you are developing a standardization process. A benchmark from which you can measure quality.
Yeah, it had to be really objective to be fair, right? So if and the system does yield some outliers through the AI analysis now, and we do go back to the surgeon, ask them, if this outlier, for example, is something we want to include or whether we want to exclude it because it's a very complicated case, or there are a lot of comorbidities associated with this procedure or that procedure. We just want to be fair, as we score the surgeons across the procedures they do.
Yeah, and I've been to conferences where there have been physicians in a room where they've, in one particular instance, a physician raised the concern that CMS data is not, in his opinion, foolproof. That he knows for certain that there are colleagues of his that are rated poorly, and he doesn't believe that those scores hold up. And so this is it's an imperfect science, but what would you say to that in terms of and how does your system differ necessarily from CMS, or are you incorporating that into your analysis?
Well, and I can liken it to looking at an egg, right? When you look at an egg from the outside, you see the morphology, you see the ovalness and the three dimensionality of the egg, but you have no idea what the yolk looks like, right? Or what the inside looks like. And I think
Mm.
for years, through CMS data, through claims data, for example, everyone's using tools to assess surgeons and surgeries they do by looking at the outside of the egg. And the reason that there's been such this barrier has been in the HIPAA, really, and protected health information. That's been the issue. But we are a group of surgeons who have gained the trust of our colleagues So we can actually see their yoke. We can see their electronic medical records, see the actual cases that they did over the previous years. So our data is much more granular. We've de-identified the records to preserve, protected health information, et cetera, and have all the securities in place. But we have the ability now to dive in and look and be very granular at the measures we're using, if that makes sense to you.
Well, yeah, and this is important, folks, because up until now, recent times, how does one go about finding a surgeon? And typically, it's all the wrong ways. They'll find a surgeon based on the directory in their Blue Cross plan or their United plan. And the problem is there's the good, the bad, and the ugly. Everything, I say it's like a box of chocolates. Everything is mixed in, and there's no measure of real quality. And so, here we have Dr. Prasad, who developed a company, a business, SurgicQuality, to cut through all of that noise, if you will, to get to the heart of who is having the best outcomes for a particular procedure. And I think you might also touch, Doctor, on the fact that there are a good number of surgeries that are just not medically necessary to begin with. And I think it gets back to the point that you made earlier about, was the outcome, did the outcome of this surgery improve the quality of the patient's life? And so for those who, think that they have the best insurance plan because of the logo on their ID card, I hate to say it, but your insurance carrier is not dispensing one iota of medical care. That's just a fact. And so how do you ascertain, A, whether or not the surgery is indeed warranted, and B, if it is warranted, who's the best? Who should I be going to?
Yeah, I mean, that's essentially, I mean, you nailed it right on the head. It's all about, they have a provider book of orthopedic surgeons, like their shoulder injury, but some may do knees, some may do spine, and they see the patient and they go ahead and do the procedure. And, um, you know, did you achieve the best outcome? That's the bottom line.
Yeah, and I don't know if you care to comment on this, but how do you get through medical school and consistently, I'm not going to say botch surgeries. I don't think anyone, goes through the trouble and the challenge and the hurdles of becoming a medical doctor to cause harm. But I do think that, with evidence, with science, with math, with, analysis, if there's a surgeon that consistently is performing at a subpar rate, should they even, continue in the practice? And how do people protect against that?
Yeah, and it goes beyond your training, right? And I alluded to that earlier. Beyond your training, beyond the foundation, it's up to the surgeon and to really keep up, right, with the latest technologies, whether it's robotics or some new laser technique or, some new modality, scopes, laparoscopes, for example. Uh, it behooves them to stay abreast of the latest technologies that are out there. Um, and it's not so easy to do once you're in private practice. You're very busy, but you've got to take the time to educate yourself, go to seminars, learn, always.
Yeah, the term in carpentry is measure twice, cut once. When it comes to the human body, I think if you're going to measure twice in carpentry, you might want to go a step or two further, before you have someone cutting into you. It blows me away. So we have friends of ours that had a daughter that recently she's been experiencing earaches and chronic ear infections and so on and so forth. And I don't know the nitty gritty details, but I know that she did go and have a surgery, and it was like a friend of the family kind of a thing, someone who's been practicing for many, many years. And, the smoke is still not all clear. We don't know exactly, what the final outcome is going to be, but she experienced complications post surgery where experienced some type of paralysis, minor paralysis in her face, and it led to an office appointment with another ENT, and that ENT proceeded to look in her ear, and his jaw dropped, and he couldn't believe what he saw. And then there was a referral to another surgeon, and then there was a little bit, frankly, of this cover your ass game that is being played between the original surgeon and sharing interoffice notes. And as a patient, you could imagine, doctor, it's extremely frustrating. I can only imagine, being the father of a 17-year-old girl, where you put your you put your most precious thing, your baby girl, in the hands of a surgeon to care for her. And look, I don't know what the circumstances are, to be completely fair. And we're not naming any names here. I'm just relaying a story to give our audience some perspective that what can go wrong. And so not having this insight of this additional layer of data to understand, well, okay, they're a friend of a friend, or they're longtime family friends, this particular surgeon, but, let's just double check the numbers. What did the scores look like? What does the quality look like? And I don't know if that would have made a difference, because at the end of the day, doctor, we all bleed, red. We're human beings. Doctors make mistakes. You not that you ever should or would want to, but it happens, right? You can make a mistake and cause harm unintentionally. But beyond that, if we're talking about the numbers and the statistics and we understand math, you want to go to a surgeon where the results are consistently high as measured against their peers. And it just is so frustrating, though, from a patient's perspective, when you're kind of you're getting caught in the vices of the system. And now you're in a situation where you had a surgery that didn't go well, and you go and you seek another opinion. It clearly looks like something went awry, and now you're struggling to find answers. And so I don't know if you care to comment on that, but this is something that is pretty recent in my circles, and it's just it can be extremely frustrating from the perspective of a patient, or if it's a loved one going through something like this.
Yeah, I mean that's a horrible scenario. You certainly don't like to hear about cases like that, but they do happen. And no surgery is completely safe. I mean, look, there's a complication rate with everything we do, and so we look back at peer-reviewed, published norms, determine what's the acceptable level of complications, how many cases did the surgeon do the past few years, and is it under that acceptable rate or is it greater than that acceptable rate? And so we start to bring some smart, intelligent information. We present it in a way that it's understandable with our nurses, and we give patients a chance to look at information and just make wise choices before you have the surgery. Just makes a ton of sense.
Yeah, and so speak to that, if you would, in terms of SurgicQuality. How do you? Is this something that I go and find you online as an individual person and say I want the rating for doctors in this profession? Is it a private club? Is it only available through employer paid plans? How does someone engage your business, your data, your how do folks find you and use your service?
So we work primarily with self-insured employers, for captive audiences. and with the regional and large insurance plans. So we have about 2,500 surgeons coming aboard next month, and they're all sharing their data. We're really excited about that. We have about 50 hospitals also that are sharing their data, and we also have a very large plan, over 3 million lives that are coming aboard and using our platform. And as we grow, we'll talk to some other regional health plans eventually. But this will be something that, look, the public is demanding quality transparency, and they should. And we're bringing quality transparency in an objective way, in a fair way, to the marketplace. And there's a thirst for this kind of information. We just want to bring it out there so that patients start to make better choices, if that makes sense. And it's a
No,
quality
yep.
improvement tool too. So we bring back scoring to each individual surgeon. They can see their scoring if they're falling outside the norms. They can change their practice patterns or get some more training, get mentored or proctored, whatever it might require to become a higher performing surgeon. It just makes a ton of sense, right? All around.
Yeah, well, it's counterintuitive, but in healthcare, price and quality are typically inversely proportion, right? So, the highest quality is often the lowest cost, and the lowest quality is often the highest cost. And so, do you take cost into account in your analysis, or is this strictly a quality assessment tool?
We're primarily a quality assessment tool, but I will say to you that, look, we send cases, surgical cases, for example. You hurt your shoulder. Our nurse contacts you. You sign a HIPAA release. We obtain your medical records, get your MRI scan with your permission, and we send it to multiple orthopedists who are shoulder experts within your plan. They report, they give the opinions on your case. And then on the back end, we're looking at their outcome scoring and bringing their opinion data and the outcome scoring all together in a dashboard so that you can see and compare. It empowers you with tools to be able to compare surgeons and just make wise choices. So that, in a nutshell, that's what the platform does.
If folks want to find you and connect with you, what's the best way to do it, Doctor?
You can email me if you want, sprasad at surgicquality.com. I'm happy to answer any questions you might have.
Awesome. Awesome. Well, hey, let's leave it there. It was wonderful having you on as a guest. Really appreciate your insight. SurgicQuality is something that is aimed at doing better for member outcomes, and we certainly could use more of that. So congratulations on a stellar career in the medical profession, and now for your philanthropical work, and certainly for SurgicQuality. It looks like good things are ahead for you. So thank you so much for being our guest today.
Thank you so much. It was an honor to be here. Thank you.
So that's it for today's episode of Broken Healthcare. Head on over to iTunes or wherever you listen and subscribe to the show. One lucky listener every single week who posts a review on iTunes will win a chance in the grand prize drawing to win a $15,000 value private VIP day with Ray Kober himself. Be sure to head on over to brokenhealthcarepodcast.com and pick up a free copy of Ray's gift and join us on the next episode.